Botswana declared the public health emergency after hospitals and clinics across the country ran out of essential medicines, leading to postponed surgeries and disrupted treatments of chronic conditions. The crisis is linked to a shrinking national budget caused by the ongoing downturn in the global diamond market. Botswana, with a population of 2.5 million, is one of the world's largest diamond producers, and the country's economy relies on the diamond sector heavily. The decline in diamond revenues has constrained public spending, including critical health sector allocations. The crisis has also been compounded by the withdrawal of foreign aid. Botswana has until recently received significant aid payments for its health services from the United States, including around a third of the budget of its anti-HIV programs. Shortages listed by the Health Ministry include medicines and supplies for managing cancers, HIV treatments, and tuberculosis, among others. To counter the growing crisis, the government has approved just over $18.7 million in emergency funding for medicine procurement. Botswana's military forces have been tasked with taking charge of distributing the emergency supplies. Yulisan Jamela for CGTN in Johannesburg, South Africa.
We have with us Lawrence Okeditse, Botswana's Assistant Minister for Health. He joins us live via Zoom from the capital, Gaborone. Thank you, sir, for joining us tonight. Tell us more about the public health emergency declared in Botswana. What has caused this?
Thank you so much, and good evening. So we declared a state of public health emergency in the country, as you would have heard and as you know by now. And the main reason has been that we are experiencing a bit of shortages, especially in a lot of the drugs that we need in our clinics and hospitals. So the president then declared a state of public health emergency, and the import of this is that we will then be in a position where we can use unorthodox methods to actually even access some of the medications that we need to access. It also means that the usual procurement laws and regulations that you normally would have to follow can be put in abeyance where it may be necessary. So these will also be a move that will ensure that we move further towards health security for our people, and it will also be a part of our long-term strategic plan to actually revolutionize how we procure medicines, because we've been experiencing a situation where we've been spending a little too much on products. You find that the distribution channels we've been using have been such that a lot of the medicines you get would be priced maybe 3, 4, 5, 6, or even 7 times the actual price, because we've been doing a lot of this through our brokers or distributors. So we are now shifting towards working with these distributors, but only if they're going to be pricing fairly and as with the markets. But we're also moving to go to a point where we're dealing directly with manufacturers of different pharmaceutical products. And we are also calling upon different entities to partner with us as we'll be looking to develop what we can develop within the country. So that is where we are now.
What kind of shortages is your country experiencing? I mean, what medical equipment or medicines are lacking at this time?
Yeah, I mean, it is because, I mean, it is linked to budgetary constraints and the way these have been managed previously. So what is happening in here is the shortages, I would say they are widespread. It's drugs and non-drugs. It's, reagents, test kits. It's different pharmaceutical offerings that we are experiencing shortages of. But much as we have the shortages, we are not in a position where I can say to you that we have run out of, for instance, ARV drugs, which are essential for a lot of our people, especially under our HIV program. So we were at low levels. I would say levels that are much lower than we normally would keep. Ordinarily, we keep, a cover that can, stock levels that can cover us for, up to 6 months without inflow. But we experienced a situation where the stock levels were dropping. And by the time we declared the state of emergency, The stock levels were now dropping to below 50%. So we needed to make a move so that we're able to then also, be in a position where we can come up with an innovative way to finance, these medical products that we need.
The
So that is where
plan,
we are.
right, yeah. Well, the plan
Yeah,
was for the military to begin emergency distribution of medical supplies on Monday. How is this progressing and how has this helped the situation?
Yeah, the plan is going quite well. Yeah, and the military did actually start helping out on Monday as we were distributing the products that were available. And you'd note that these products were actually also gotten from some of the local suppliers that are available. So what we have done is this: we ordinarily run our medical supplies through what we call the central medical stores. And some of the problems that have occasioned with all these overpricing and such problems were actually occurring with the central medical stores being in charge. So we are shifting slightly to capacitate the central medical stores to close the loopholes where there's been a bit of wastage. And then we are also involving the military because, as you know, they are very efficient at distributing items and mastering their logistical plans. So it is to just basically ensure that these goods reach the intended recipients on time and efficiently. So we are making some progress, but we're still calling out to our partners and friends across the world to come out and work with us. We have very robust systems that work. But from time to time, when you have challenges, you need your friends to stand with you and offer support.
Botswana is one of the very few countries which managed the COVID-19 outbreak without any serious challenges. And the country is also seen as one of the wealthiest in Africa. So the question is, how did things get to this level of medical shortages?
Yes. So, I mean, you speak of COVID-19, which is great, but then also you remember that this winter in Geneva, Botswana received a gold chair from the World Health Organization for the way it has managed the HIV/AIDS pandemic. So that's why I keep talking about robust systems that actually work. The systems work, but we've had a few years where diamonds are not selling as they used to be selling. And as a result, partly of that, you found a situation where the stock levels were falling because we just didn't have as much money as we used to have. So when you have stockpiles of diamonds, or one of your major commodities, not quite selling as before, it also means that the country may experience a temporary liquidity challenge, and that is where we are. But it is not just a case of the liquidity challenge. It is a case of how the supply chain has been managed over the years. It has largely survived and run because you could still go get a supplementary budget and input into buying medicines. But we have decided that we are not going to continue with a system where what budget we get, we run down, and then we go get more money to put into the same things. We are going to instead have a little more efficiency and agility in terms of our procurement systems. And we are researching the system for future generations. We're going to ensure that from now onwards, our procurement actually gets us more for less, as opposed to, like I've said, what has happened. So in reality, the big problem has not really been a lack of money per se. The big challenge has been that for many years now, the distributorship has largely been, maybe in a way, we've been paying through the nose when we shouldn't be. So we are fixing the system so that we can get a proper value for every pula that we spend as a country.